typical vertebra 3, 4, 5, 6. These are the 4 typical vertebra. And atypical first, second, and 7th. You know the differences. After I show you here, plus individually, you please leave, before leaving, see the skeleton, the cervical skeleton. I think last day you all were in a hurry and you left the class. So don't be in a hurry. You have to finish it. Okay. Now, just let me know how many people are coming on Thursday. How many people are attending class on Thursday? Are you attending? Now, this is the first cervical vertebra. The arch has a facet, oval facet, to articulate with the odontoid process. Now, the upper articulating surface, oval surface, articulates with the condyles of the skull. That's why that day I told you about hanging and homicidal hanging and your suicidal hanging. I told you last day. Okay, you have to identify, and the foramina is the characteristic features of cervical vertebra. Lumbar or thoracic or yours, they don't have the foramina on the processes, lateral processes. Now, you please, you circulate, you see the 2 malas, and then you go and see in the skeleton. Now, this is the 7th cervical vertebra. These are all atypical. Okay. The rest is, if you are given this, you count from the first cervical, second cervical, third cervical, fourth cervical, fifth cervical, sixth cervical. Please circulate, please see, please see. একবার করে দেখে তোমাদের part, you see, you and your, by the time you see this, just pass down. Sadhana, Tantra, more than 150 years old, my goddess Kali is. Okay. Now, why I'm telling you, see, these 2 skulls are not artificial, not plastic. You can see the styloid process. When you will teach you the skull bones, the styloid process, it is there. Both are intact. When I seeing this, because either it is broken or this thing, but when this whole these skulls, the bones were delivered, they were brought in a pudli. I examined each and every skull and then signed in the initial phase. Now, this is a very good skull. You can see these 2 condyles here. This articulates with the, now, the odontoid process. Now, regarding the articulation with the axis and atlas, the odontoid process, the fracture, even not only is homicidal or suicidal, this thing, even when you are going high speed, motorbike or car, then head-on collision, and that breaks this cervical this odontoid process. Then spot death, because the medulla, everything is coming down, the spinal cord, everything is coming down to this foramen magnum, and you see the I can see you like this. I can see everyone. The whole spinal cord is being protected. Why it is done this? Because it is protected. Because when you open, you see the brain and the spinal cord, you will see that how delicate it is. There's so many neurons and the whole tracts are there. You have to see that if there is in physiology you will be reading that upper motor neuron lesion, lower motor neuron lesion. These questions usually come. And if hemiparesis, paresis, paralysis, these terms you have to know when you are reading your physiology and also anatomy. You please at least dekhe now, see it. They won't ask you many questions. They'll see if you are atypical vertebral pneumonia. Don't think of it. তিনটে আছে আর ওদিকে চারটে. Now you just see, একবার হাতে দেখে নাও, এগুলো দেখে নাও, don't drop it, don't break it, please, because you will be, when you are reading the pharyngeal group of muscles and all, head neck region, the stylopharyngeus muscle, stylohyoid, these are all styloid process, and these is attached, you will see in very good atlases. ধরো ঠান্ডা লেগে গেছে আমার, বলো জোরে বলো। হ্যাঁ বাড়ি যাবে? হ্যাঁ থাক, একটু টাইম হয়ে গেছে তো, 12টা, এটা তো তোমাদের টাইম। আমি সেদিন বসেছিলাম, আমি জিজ্ঞেস করলাম তখন 12:20 বললো সব চলে গেছে। যাই হোক, আই এম জাস্ট টেলিং দি ইম্পর্টেন্ট পার্টস, বিকজ ইউ হ্যাভ টু গো হোম অ্যান্ড সি ইট, প্লাস ইউ সি ইট, জাস্ট একবার হাতে দেখে নাও সব। হ্যাঁ নাও, এটা নাও, ঠিক আছে? আর just the articular surface. এটাতেই রাখ, দেখে নে। I am in my room. 10 minutes I will be leaving for, I have to go to the administrative building. তোমরা দেখে নাও তোমাদের সময় মতো করে।